Emergency crews have evacuated 3 passengers with suspected hantavirus from the cruise ship stricken with a deadly outbreak of the disease. And meanwhile, experts are confirming there have been cases of a rare strain on the ship that can be transmitted between humans. The head of the WHO says 2 crew members and 1 other person are being flown to the Netherlands for care. And as of today, the WHO has identified 8 suspected and confirmed cases on the MV Hondias. It's a rare strain, the Andes variant, and it's been confirmed in patients receiving care in South Africa and in Switzerland. South Africa says it has begun contact tracing. 4 Canadians are still on board that ship. The CBC's Crystal Gumansing leads off our coverage this morning following developments from our London bureau. Crystal, what do we know about those who are sick?
Well, let's start with those 3 individuals who were medically transported off of the ship today. We heard from the World Health Organization as well as the Dutch foreign minister confirming that 1 was a British individual, a German individual, and a Dutch individual. We know that there have been 3 confirmed laboratory cases of hantavirus, specifically the Andes strain of the hantavirus, which is common in Argentina and in Chile, and that the WHO says there are 8 confirmed cases. You mentioned the 1 case in Switzerland. That, according to Swiss officials, was an individual who was previously on board the vessel and went back home. That individual was showing symptoms, presented himself to hospital. That individual is being cared for, and they've also isolated his wife as a precaution. So we are starting to see more information coming out about individuals who are suspected to have hantavirus or they have been confirmed to have this virus. And there is a lot of tracing that is going on now, trying to confirm exactly what type of virus this is, if it is the same strain, and they're tracking where it is all going. So this is a story that continues to develop as we do get more information from the WHO, which is really taking the lead on this, Susan.
There's no treatment for hantavirus per se, and because there are different strains of hantavirus, different strains can affect you differently. The Andes strain and most strains that are found in North and South America in particular tend to cause something called cardiopulmonary syndrome. So basically it causes a capillary leak. Your lungs will fill with fluid. If you can be brought to hospital, if you can be put in an ICU, if you can be intubated or even put on a heart lung machine in the extreme case, what you're basically getting is supportive care. You are keeping somebody alive until the virus clears the system and they recover.
So that there was Dr. Christopher Labos talking about the serious health implications of this virus if it does sort of progress to an acute stage. And we do know that 2 of those individuals who were taken off the ship, officials with the ship liner, the organization that oversees that vessel, Oceanwide Expedition, says 2 of those individuals were dealing with acute symptoms.
Crystal, that ship has been stranded really out in the middle of the ocean, not having a port to get to. And now the Canary Islands, there are some officials there who don't want it to dock there either. What do we know as of now?
Yeah, so it is sitting off of the west coast of Africa, Cape Verde. It has been there for a couple of days now. World Health Organization officials yesterday said that the Spanish government had given the vessel permission to go to the Canary Islands. But we are now today hearing from the president of the Canary Islands, Fernando Cavillo. He is expressing real concern and frustration, saying that he hasn't had any communication from the president of Spain. He has not heard from Spain's health minister, that he wants more information and doesn't understand why this vessel would take the 3-day trip to the Canary Islands to then do more testing and have all of these individuals disembarked. He's saying that can happen where it is currently. There are also people in Tenerife who are expressing concern, wondering why the vessel has to go there and the potential for this virus to spread to other individuals. We are hearing from officials with the WHO who are stressing that person-to-person transmission of the hantavirus is, quote, very, very rare. It has occurred in this situation, but they are trying to downplay the overall fear and the possibility that if these individuals do go to the Canary Islands, that we would see widespread transmission, saying it has to be very, very close contact for this spread of the virus. So there is a lot of concern. There is a lot of question. The president of the Canary Islands saying at this point, all he knows is there is a request for a vessel to dock on Saturday, the 9th. He has requested some more information from the WHO and from Spanish authorities, Susan.
Some holiday for those on that ship stranded out at sea for days, including 4 Canadians. Thanks for the update, Crystal.
Yep.